This gentleman.
The early data on consumers, if we're all consumers of healthcare, all right, and I think it's reasonable to call us consumers, the early returns on consumers populating what are called personal health records, or PHRs, and taking responsibility for keeping that information is actually not very good. It turns out that most people won't keep their medical records up, their own personal medical records up. And so we really do rely upon our providers to feed information into a repository of some sort. And there are at least 1,000 different efforts going on in this country now to try and find the practical solution to that problem where people will actually cooperate and assist in the collection of their medical data, because it's potentially a gold mine for certain folks that want to reach those consumers.
So why don't we take one or two more questions, and then we'll adjourn the formal part of the program and invite everyone to stay and have some refreshments, and I'm sure that our speakers would be happy to talk for a few minutes with anyone who would like to speak with them. So this gentleman.
Yeah, you mentioned Stanford was a level 1 trauma center. What are some of the other categories, and what's the difference between, say, a level 1 and level 2, or whatever it is?
Yeah, level 1, it really has to do with what resources you have immediately available in the house, in the hospital at one time to take care of trauma patients. There's basically 3 levels of trauma center designation, 1, 2, and 3. For example, Stanford and Valley Medical Center are level 1. Regional Medical Center is a level 2 trauma center. And it really just has to do with, again, what subspecialties you have available. They all have to have general surgical specialists available to handle trauma patients. The whole idea is to be able to get people to the operating room quickly if necessary.
The big difference between 1 and 2 is the research and education component.
Yeah.
So a level 1 and a level 2 are roughly equivalent in terms of the clinical care that they can render, but a level 1 center, such as Stanford is, has an even greater devotion to trauma care by virtue of the fact that they dispense resources associated with education, training, research, et cetera. It's not just having the doctors there, but it's actually having an active participation. But between 2 and 3 is a drop-off, because at 3, there is not the same requirement for having the same in-house services. You can have certain services on call, and on call is sometimes not good enough.
Well, let's say heart attacks or auto accidents, level 1. So you're saying level 1 and 2 would handle, say, both heart attacks and auto accidents?
Yes.
But level 3?
Level 3 would be less able to manage that, and that's more the situation that you would encounter in a rural environment.
Okay, last question in the back corner.
You mentioned the statistics about the overall loss of hospital beds and ER rooms nationwide, and I have some suspicion that that's, of course, due to adverse cost containment pressures from insurance and whatnot. How is this type of thing affecting your abilities to keep up with the population increase needs?
Well, it's you know, it's they're both working against each other. You know, I mean, I think if we had the same number of beds and space, we'd be busier and busier because the expectations of patients are increasing. I mean, it's not a secret. I mean, we can do more for people. We know that early interventions are more important. The population is aging, okay, so there are more people that need services. And so whenever a facility closes, I think Los Angeles is probably the most dramatic example. You know, when there are some big hospitals in Los Angeles that closed precipitously, and that absolutely overwhelmed and inundated their emergency care systems. The other hospitals were instantaneously overwhelmed, and it put patients in jeopardy. We fortunately we've had a few hospital closures in our catchment area, but we've been better able to prepare for it because we had notice, and the rest of the county and the region geared up to be able to deal with that. But if, for instance, Valley Medical Center decided they were going to close in a week, we'd have a big problem.
So thank you all so much for coming. We so appreciate your interest and that you would take the time to come and listen and learn with us tonight. I think it's been an incredibly informative evening, eye-opening for all of us. And thanks again to our speakers. I hope you'll enjoy some refreshments and that you'll come back and see us in September.